They're fighting on several fronts in India. Fighting to save lives, but also fighting to tell it as it is. And those at this hospital in Lucknow are now facing police charges for doing just that. Every COVID patient who arrives here desperately needs oxygen. But those who sounded the alarm about oxygen shortages at this hospital are now being charged under the National Security Act and face being arrested at any moment. The head of this small hospital says 4 of his patients died in one day when oxygen ran out. He showed me the messages he put out, desperately asking for help.
सन हॉस्पिटल में 45 मरीज और ऑक्सीजन है। 45 मरीज को ऑक्सीजन लगा हुआ है, जो कि हमारे यहाँ ऑक्सीजन नहीं है। कृपया करके अर्जेंट ऑक्सीजन देने की कृपा करें।
When he got no response, he put out a notice telling relatives they should take the patients elsewhere. A number of them did, but others had no choice. The hospital head took us to see his small oxygen store. It's again at dangerously low levels. The state's High Court has said not supplying oxygen to hospitals is a criminal act, no less than genocide.
ये 5 सिलेंडर जो हमारे पास जो 5 ऑक्सीजन सिलेंडर है, ये हम 38 पेशेंट को लगभग 1.5 से 2 घंटा दे सकते हैं। तब भी हम लोग प्रेशर कम करने के लिए 3 घंटा इसको चलाएंगे कि जैसे हल्का सा प्रेशर कम करने पे 3 घंटा 3.5 घंटा चला।
But the oxygen ran out by 9 o'clock that morning. The relatives of those who died say that's what killed them. If the oxygen had been there, my aunt and cousin would not have died, he told us. As we travelled through Uttar Pradesh with its huge population of 200 million, we found many ignoring COVID warnings. This is meant to be lockdown, still bustling with people and few masks. In the shadow of India's most famous monument, they appeared oblivious to the virus. Doctors we've spoken to say the mutation, which has spread to other countries, including Britain, is a far more aggressive, infectious variant and affecting far younger people.
It seems that the virus is more lethal this time. It seems so, because the number of deaths have been a little higher than what we saw last time. Also, what we are observing is last year it took some time for the patient to deteriorate, but with this virus, the infectivity or the aggressiveness of the virus is so high that it hardly takes a day for the patient otherwise fine to desaturate and get compromised.
There's a fear about contradicting the official numbers. But this crematorium in Agra has run out of wood and is now using cow dung for its funeral pyres. Nearly 2/3 of Indians live in remote, rural areas, unable to get any help for COVID, with many dying at home and untested. The workers have no protective outfits against the virus, whilst telling us they've never been so busy. But they're reluctant to give exact figures. Why don't you just tell them, the young boy behind him says. He gets a furious response. In these areas of such deprivation, where religious sadhus are often the only people recognizing the dead, we may never know the real toll of the pandemic in India. Alex Crawford, Sky News in Uttar Pradesh.